Britt Talley Daniel MD, and I'm a neurologist and a member of the American Headache Association and the American Academy of Neurology. And I've also written a large textbook entitled Migraine, which is on Amazon, which is really a textbook. It's big. It's about 400 pages with 900 references. And I have a smaller book on migraine. It's about 40 pages. And if you can get there, go to my blog, drmigraine.com. If you cursor down the bottom and click on Shop Books, you can find those books as a print book and an ebook on Amazon. I also encourage everyone to subscribe to my page so you can follow me. Appreciate that. Today I'm talking about Ubrelvy, which is a new drug that's been approved for acute therapy for migraine by the FDA. And this drug is a CGRP antagonist. It's a drug that blocks one of the chemicals that comes out in the brain during migraine. And wow, in the last year and a half, haven't we found that the new CGRP drugs for prevention of migraine, which are given about once a month, have worked really well. They're just wonderfully well. And those drugs are Ubrelvy, Aimovig, and Emgality. Those drugs are antibodies, and this new drug we're talking about, Ubrelvy, is an antagonist blocking this chemical that comes out with migraine that seems to inflame the brain. Now, the CGRP antibodies are so good because they have such few side effects. They were given by a subcutaneous injection, like in the leg or in the abdomen, once a month. And I try not to be too tough on my patients when I tell them that diabetic patients who require insulin have to give a shot like that 4 times a day for life, and migraine patients would just have to do it once a month. So it's pretty mild, and the drugs work really well. So what's been reported there is that half of patients taking this shot for prevention of migraine once a month have 50% reduction of headache, and another 25% have had 75% reduction of headache, and a further 25% of migraine patients have had 100% reduction of migraine. Wow. I've seen patients come into the office that may have seen 3 or 6 months earlier. They start on the medication. They come in and say, "I don't have a headache at all, and I have a migraine at all." And I have never seen anything like that. I've been practicing medicine, neurology, for 50 years. All right. So this new drug also has a benefit in that it doesn't have any side effect, as far as we know at this time, of coronary artery disease or stroke, because the triptans do have a restriction for that. So triptans are drugs like Relpax or sumatriptan that are given orally or by injection. In the case of sumatriptan for acute therapy for migraine, they are contraindicated by the FDA for persons who've had coronary artery disease, like a heart attack, persons who've had a stroke, and things like that. The only problem with triptans is that 78% of patients will respond. So that leaves 20 to 30% of patients who won't respond to triptan. And this new drug may be something that's useful in that group of patients, and they're non-triptan responders. Okay, so does Ubrelvy work for acute migraine treatment? That's a question, and I would say yes. A recent December 2019 article in the New England Journal of Medicine reported that 20% of patients who received a 50 milligram or 100 milligram tablet of this drug had freedom from headache pain in 2 hours. So the FDA approved the drug for acute treatment of migraine. So it's not a drug for prevention, but it's for acute therapy drug, like a headache medicine you would take now when the headache comes on. So what drugs should not be used with this? What's the contraindication of medication regarding this drug? That's drugs that have a CYP3A4 inhibitor. Those are ketoconazole, itraconazole, and clarithromycin. What are the reported side effects of this medication? Well, it can make you nauseated, it can make you have a dry mouth, it can make you somnolent. And I've heard other migraine doctors describe that it may be a benefit for patients. If they get a migraine in the evening, they can take this Ubrelvy, which makes them sleepy. They can go to sleep during the night. Well, it gets rid of the headache, which you wouldn't do with a triptan. What's the dosage? Well, the drug comes in a 50 milligram tablet, and that can be taken 1 or 2 at onset. Usually 1 at onset 50 milligrams, and you could wait 2 hours to take the second one. The maximum amount of drug you can take in Now, there's a special population of patients with migraines that might be considered for use of this drug. Pregnancy, patients that are pregnant. Really right now at this time we have no adequate data on the developmental risk associated with use of this drug. A comment there would be when triptans first came out 30 years ago, the FDA said then, and they still have this on their page, that they're contraindicated in pregnancy, but it's been found by our clinical studies that triptans really don't have any big side effects with pregnancy, and so people have used it a long time safely without any problems. That may happen with this drug, I don't know. Right now you're not supposed to take it. Lactation. There's no data on the presence of this drug in human milk, and the effects of the drug on breastfed infant or on milk production are really unknown. So the FDA has left it that the clinical practitioner, the neurologist giving the drug, could make a decision based on how bad the migraine is. If the patient is a triptan non-responder and you need to treat the headache, because migraine headaches is a serious problem, and you get dehydrated and sick, and it's better to take a small risk during pregnancy or breastfeeding for some of these patients than to not treat them. So in lactation, you can use it for certain patients in that consideration. How about pediatric use and geriatric use? Pediatric use is not safe or effective for patients that age, shouldn't be given, but geriatric, there's no big problem. As far as we know, if there is a problem, you can drop the dose. It seems to be okay. Patients who've had mild or moderate hepatic or renal impairment can take the medication, but severe hepatic or renal impairment really should drop the dose for that. So another hope for this class of drugs is, they're calling these drugs GPANs, is that they could be used in patients who have coronary artery disease, which would be great, because this drug doesn't affect constriction of the heart. It's okay with heart disease or stroke problems. And it may be one of the drugs that fills in this little gap in triptan therapy that we have. So, good luck to all you